New details tonight following multiple deaths at Asante Road Regional Medical Center. A look at the hospital's potential history of acquired infections and what the State Nurses Association is saying. Good evening and thanks for choosing NBC 5 News at 6. I'm Jenna King. Today we're continuing to follow the story involving a police investigation into what sources tell NBC 5 News include multiple patient deaths at Asante Road Regional Medical Center and how the hospital may have a history of hospital-acquired infections. NBC 5's Maximus Osborne is live in studio with more on the story. That's our top story tonight at 6. Maximus.
Jenna, we have learned that Asante has investigated a potential link between hospital-acquired infections and water quality issues. Last year, the former Asante Vice President of Quality and Patient Safety wrote articles published on the hospital's website about hospital-acquired infections. We have learned of a 2023 article about ICU infections believed to have been caused by waterborne bacteria. To recap what we know, multiple Asante sources who do not want to be named tell us as many as 8 or 9 Rogue Regional Medical Center patients died as a result of drug diversion. They say a nurse in the intensive care unit replaced fentanyl medication used for pain with tap water. Our sources tell us the tap water, which is not sterile, led to multiple infections of Pseudomonas. A 2023 article by the former Asante Vice President of Quality and Patient Safety, Holly Nickerson, shows how Asante was no stranger to hospital-acquired infections. It said that the hospital was seeing central line infections from leaving IVs in too long.
Obviously, they were concerned about infections, hospital-acquired infections. Now, IV infections usually are Staph aureus, not Pseudomonas. However, I think they had an inkling then.
Dr. Robin Miller is the host of our Docs on Call segment, and she says that leaving an IV in too long wouldn't necessarily result in Pseudomonas, which is a waterborne bacteria. However, there was another earlier article by Nickerson as well that says in December of 2022, several central line infections in Asante critical care units were linked to waterborne bacteria.
It kind of doesn't make sense because I don't know how water would get into a central line to cause a waterborne illness unless it was injected.
Dr. Miller still doesn't understand why tap water was used when hospitals have sterile options.
The least harmful of those would be the sterile saline, and it is readily available. So I don't understand unless whoever was doing it was impaired and not thinking.
As Dr. Miller told us yesterday, switching out a patient's medication for personal misuse or drug diversion isn't a situation unique to the Rogue Valley. She says that 10% of healthcare workers divert drugs, according to several peer-reviewed journals.
Many people have questioned the 10% figure. But honestly, you have to realize that medical professionals are people. And to think they don't have drug issues is naive and dangerous.
If you want to refer to the studies about national drug diversion rates, you can visit our website. I also spoke with former Asante Vice President of Quality and Patient Safety, Holly Nickerson, today. And while she couldn't comment on the current investigation, she did tell me she no longer works for the hospital system. And the articles that we mentioned that appeared on Asante's website have since appeared to have been removed from public general access. Live in studio, Maximus Osborne, NBC 5 News.